So in this, we have some public testimony. Tony Landry with the Veterans Action Council.
My name's Tony Landry. I'm a 6-year veteran from the Navy. I had some back injuries while I was active duty. Got out and I became addicted to alcohol and opiates. So I'm here today to testify in favor of using psilocybin for addiction. Psilocybin being studied by the VA and several other, John Hopkins and several other institutions. They study psilocybin to use for addictive treatment. And I want to begin with a quote. It's by Gabor Mate, who's a best-selling addiction author. It is impossible to understand addiction without asking what relief the addict finds or hopes to find in the drug or the addictive behavior. There is a purpose to all behavior and feelings. We just need to look a little deeper to find it. On the surface, addictive or self-destructive behavior seems illogical, but if we focus on its benefits, few though they may be, we will be able to unlock the mystery of the behavior and put ourselves in a position to change it. Approximately 283,000 veterans reside in Louisiana. While 6% of the U.S. population is served in the military, veterans make up 10% of emergency medical technicians, 19% of firefighters, 25% of police officers, according to a 2015 report by the U.S. Department of Labor. So the veterans, they're serving in the military, and chances are likely they'll come back with some traumatic physical, emotional injuries, and then they're making up a large portion of our first responders. So they're very likely they're going to have some emotional and trauma, which leads to addiction, eventually. Psychedelics such as psilocybin, LSD, DMT, as well as psychoactive drugs like MDMA and ketamine are the most promising treatment approaches in contemporary psychiatry today. If you have like some new antibiotics, or maybe antibiotics aren't even invented yet and somebody develops an antibiotic, we want to take advantage of that and use it to our best advantage. The VA, again, is exploring psychedelics for treatment of veterans. I attached a podcast in my testimony from Jonathan Lubecki, a Marine and Army veteran who was made several attempts at suicide, and he got the MDMA treatment, and he's been PTSD for many years now. In closing, it is the duty of all Louisianans to do everything possible to help veterans and first responders recover from the trauma suffered while serving our country and our state. Please embrace psychedelic therapy as the most promising treatment approaches in contemporary psychiatry today. Decriminalize the use of psychedelic plants for treating mental health. Create a framework for psychedelic therapy, research, education, training facilitators and clinicians. Establish community and clinical guidelines for psilocybin-assisted psychotherapy centers. Thank you.
Thank you, Mr. Landry, and thanks again for your service.
Thank you.
The board is clear.